Why do you smell cigarette smoke or exhaust or something burning when it is not happening, but yet you're in perimenopause and menopause and it seems like a symptom, but nobody knows why? Menopause does affect your olfactory nerve and your ability to smell, and it is interesting. Your olfactory function decreases with age, but some people experience these phantom smells with or without menopause, just like if you had radiation of your face, if you have a sinus issue, but it can specifically happen with menopause because remember, as your estrogen declines, tissues become affected, and who knew that this would be affected? Olfactory dysfunction adversely affects the quality and safety of life. In this particular study, they looked at women who were in reproductive age and women who were going through the menopause transition. They looked at the ability to identify 5 smells. They had a nice setup, found that the decrease in smell in postmenopausal women might be due to the normal aging process. However, it seems to be more dependent on the decreased estrogen secretion. This is the only article that I have seen that talks about the decrease in the mucosa, the decrease in the metabolizing enzymes. There is ossification in the cribriform plate foramen. There is selectivity of receptor cells to odorants that is lost or diminished. So think about like your taste buds changing. So think about the schnoz changing. Changes in neurotransmitters and neuromodulators. That ADHD and perimenopause has been talked about. Smell is not talked about because, well, we are just behind. But this is the only article that I have seen that straight calls it out. It makes perfect sense. So menopause is a unique transition. Everybody experiences different symptoms based on who you are, your genetics, your life. When I was looking for the phantom smells of menopause, I do know that my friends at Morpheus have an article. Let me show it to you. My friend Andrea does research for menopause, and this is her company Morpheus, and this particular article you should check out, Menopause and Phantom Smells. And she goes on to talk about what are phantom smells. Phantom smells are basically a hallucination. You think you smell something and yet there's nothing to cause the odor. This varies from person to person, but it can be an unpleasant smell such as cigarettes, mold, chemicals, or burnt toast. People may experience these smells for a few hours, days, or even weeks. However, research indicates that 52 to 72% of smell disorders are related to sinus issues. That is great, but in these cases, they may experience a more pungent smell in one nostril. The phantom smells are associated with the brain, tend to be more persistent. So phantom smells can be life-altering, but in perimenopause, it is a tell of something else. And once again, this is where being a good historian, asking questions of your patients is a good thing. Of course, differential diagnosis to rule out any other things such as dementia, Alzheimer's, dysfunction, things of that nature. So how are phantom smells associated with menopause? Nobody really knows for sure. And if you look, you're going to find lots of people talking about it. However, it is believed that the decline in estrogen affects the olfactory system, which has estrogen receptors. The lack of this hormone may cause women to experience smells that don't exist in the environment. Now, in the previous article that I talked about, that talked about the ossifications and the cribriform plate up in here, I like to think about that as it is impeding the nerve conduction, possibly to the nose. Also, mucosa not being as plump and supple kind of speaks to me because if you think about other systems, our dry eyes, dry mouth, our gums, So why are we surprised that a mucus area is going to have some issues? We shouldn't be surprised. What is not also surprising is that there isn't research on it. And I know people think phantom smells is not important, but like, there are other things that have phantom smells that are scary, so we should know. We should know. Anyway, clove cigarettes is my smell. Tell me what you smell. Bye.